Susie Keller, you are back. How are you?
I'm back. I'm doing well. Thank you for having me.
Thank you for coming in today. It's been months. I don't think you and I have gotten together since the legislative session, yeah?
That is true. That's true.
God bless it.
We've had a moment of rest, hopefully.
Well, the big, beautiful bill did come out, and that definitely did some things to people's access to healthcare. So perhaps a rest in the podcast world, but, medical things continue to develop.
Yep. They keep rolling and rolling.
Listen, you and I are here. Some big things came out today. The conversation around women's reproductive health, which is actually how you and I met a couple years ago,
right?
Because I wanted to understand what Idaho's position was, what the ramifications were, and how all those details play out. And in that first conversation, that was, again, I think over a year ago, you're like, look, Idaho at the time had lost, I think, 25% of their OBGYN statewide. Mm-hmm. And that information went out. And instantaneously, people started bringing a lot of different details like, well, this is, a function of just decreased OBGYN access across the United States. This is a function of people retiring. This is a function of our aging population and fewer OBGYNs are needed. All of these different things, right? And again, I'm not a data scientist. I'm not just sifting through. And so there was a lot of okay, that's curious. How true is this? How not true is this? Had other people on, but today, JAMA, right? Journal of American
Medical Association.
There it is. Produced a study that's drawn very clearly from data to say not only did we lose OBGYNs in 23, immediately following the trigger law going into effect, we also lost them in 24 in spite of all of the best efforts of the medical community in Idaho.
Right.
Talk to me.
Exactly. So this is something that the Idaho Medical Association has been watching. So yes, a study came out last year showing, we had a loss of physicians. And just today, the Journal of the American Medical Association, JAMA, published this new study that just came out that has looked from that time in August of 2022 all the way through December of 2024. And it's not fantastic news. So it turns out we have lost during that time a net of 35% of our practicing OBGYNs in the state of Idaho have retired, left the state. The majority of them left the state, stopped practicing obstetrics and just went to practicing gynecology. So we know that there are 94 of these original 268 physicians, OBGYNs. That's how much we had at the end of 2022. And then a net number at the end of 2024, we lost 94 during that time. And that does include that net number 20 that we did recruit into Idaho during that time.
So that means that we lost theoretically over 100.
We lost 114.
And we started at 168. 268. So we started at 268. We lost 114, which means we should have been down to 154 from 268. And the Medical Association, in collaboration with a bunch of other, the medical establishment, was able to recruit back 20, and that's it.
Correct. And that was mostly done by hospitals in large urban areas. And that's another thing that the study looks at too, is our OBGYNs, because of these changes in the practice environment over the last 2 years, they have really now concentrated in our most populous counties, which then of course means that access to care is even more difficult in more rural areas of the state.
Okay, so we lose 114, and then we're like, okay, let's get 20 back. But those 20 they don't evenly distribute. They go to very specific areas.
Mainly Treasure Valley, I would say.
Okay, so the Treasure Valley clawed back 20, but if you're living in Idaho Falls or Twin or Sandpoint or Coeur d'Alene, you lost, but you didn't gain back in the same way.
Right. What the study shows specifically is that over that time, now we have a concentration. So we have 174 practicing OBGYNs at the end of 2024. Right. I want to say 150 of those are practicing in 7 counties. the 7 most populous counties in Idaho. So the whole rest of the state, 500,000 people, theoretically are being served by a couple dozen OBGYNs outside of those 7 populous counties.
Okay. Of the 114, and again, I understand you clawed back 20. Okay. But of the 114 that left, right? So starting at 268, we lose 114. That's like 40%?
43%.
Okay. So we lose 43%. And again, to be clear, net, we only lost 94 because we were able to get, but of the 114 that left, what were the reasons that they left? Because again, a lot of people that, commented on these things said, no. We lost 114 OBGYNs in 2 years, but like 90 of them retired. It's like, okay, did 90 of them retired? Or they, they don't believe the metrics for counting. But we had instances of people staying in Idaho that literally just said, I'm not delivering babies anymore. I'm going to stay in the medical field. I'm just not touching this egg. And I'm even staying in women's health. I'm just not touching this guy. We had people that left state. We have people that retired. We have people that, moved. Help me understand what happened to the 114.
Okay. So I'm actually going to break it down because they were really able to dial in on the 55 who left in 2024. So this study specifically looks at that period from the rest of the first study. So basically, we're looking at the year of 2024, and there were 55 physicians who stopped practicing during that period, and these were the ones they were able to track on a pretty granular level. So of those who left in 2024, 42% of those left Idaho, and we know where they went.
Where did they go?
5 to Washington, 3 each to Minnesota, Nevada, Oregon, and Utah, 2 to Colorado, 1 each to Illinois, Maine, Montana, and New York.
So nobody to California.
No.
That's actually a very interesting point because there's been a large criticism of the doctors that are leaving saying these are just like lib, woke, ridiculous, whatever insult you want to lobby at them, instead of saying, okay, maybe this person's not an idiot and maybe they're leaving for reasons that make sense aside from like political reasons. But you have a smattering of like, no. Some left to conservative states. Utah notably has very strict abortion laws, but it has an exemption for health of the mother, which include, permanent or significant loss of function or loss and damage to, organs of things like that.
Correct.
So the people that are leaving are not just leaving to like California because they're these woke, crazy doctors.
Well, and here's something that I like folks to keep in mind too. So before our trigger abortion ban went into effect in the before times, less than 1% of Idaho physicians were performing elective abortions. Of all the physicians in Idaho, very, very, very few were performing elective abortions. We have now gotten to a point, since we've had the abortion ban in place, that we've lost 35% of our OBGYNs specifically. So not all of those folks were performing elective abortions. So I guess the point I would like to make is this law disproportionately impacts women and families who are trying to bring a baby into the world, but have a very unfortunate pregnancy complication. But the strictness of our law prevents our docs from treating her in the manner that they always have up until August of 2022.
To that end, Dr. Megan Casper, who I've had the pleasure of having on several times, she is a pro-life OBGYN. She has never performed an elective abortion. She didn't do it in medical school. She went to a conservative medical school. She now lives in Idaho. She's also an MFM specialist, maternal fetal medicine specialist. And she has said in our conversations conclusively that the existing legislation makes her job keeping mother and baby alive and safe very difficult.
Yes.
And this is somebody who has never participated in this and has no intention of ever participating in elective abortions.
Right. But to your point, I've seen those same comments like, oh, those docs who are leaving, they were just trying to, push abortions on everybody. No, they were trying to keep somebody's wife from losing their ability to have children in the future. They were trying to save somebody's sister's life or kidney function, So to put them all in a bucket like that is really disheartening. And now we have numbers to say, no, that's not what's happening.
To that point, and before we move on, and we can, but I had a guest recently who had 5 children, and she told me off air, she was like, listen, before I had my first baby, I had a pregnancy that really went bad. And she very unfortunately had to terminate the pregnancy. She would have lost her uterus and her capacity to bear children. And she went on after that, as horrible and heartbreaking as the whole situation was, she went on after that to have a huge family. And she loved every single one of them. And it was great. But she was telling me, she's like, imagine if I was here now doing this, I wouldn't have any of my children because it would have ended with my loss of the uterus in the original pregnancy that she wasn't able to bring to term. And that really stopped me. I was like, oh, wow. And here's somebody who really likes kids, really wanted a big family, did in fact have a big family. And we know conclusively, she's like, if I had continued with that pregnancy, which I would have had to do under Idaho law now, I would not have been able to carry another child.
I have heard dozens and dozens of stories just like that from a broad spectrum of women and men whose wives have gone through these things across the political spectrum. So up until 2022, it was just part of evidence-based medical care where you, in a very sad situation, had to do a medically necessary termination. And now it's become a line in the sand. And now it's become a political question, unfortunately. And the impact is that Idaho is losing physicians probably at a greater rate than other states. And we're having a bigger hurdle to climb in trying to compete. So
right, to attract them back in.
100%. So you very rightfully said, and folks say this all the time, oh, there's an OB shortage across the country. Yeah, that's true. So what is Idaho doing to compete with other states to attract OBGYNs to our state? Because there is a national shortage and there is a maternal healthcare workforce shortage across the country. So we're competing with Utah and Washington and Oregon and Nevada and Colorado for OBGYNs to practice here. So what are we doing as a state that's saying, hey, we want you to come here?
And compound that problem with the fact that we don't have a residency program, right? And it's my understanding from people I've talked to about this problem. They're like, look, one of the number one predictors of where somebody's going to stay is where they're finishing up their residency.
Yeah.
It's like, they met a nice person, they got a cat, it's like, this is my spot. They know where the good restaurants are. And they're like, listen, I'll just work here. And we don't even have that home field advantage. We always have to get OBGYNs from out of state. So we're already fighting an uphill battle.
That's true. And we're actually really good at retaining our residents that train here. So someday we can do that.
Okay. So 55 leave in 24, 42% of those people, I think you said, left and went out of state.
Right.
What happened to the other 58%?
Okay. So 22% of them retired. 16% of those decided to stop practicing obstetrics and just practice gynecology.
And this is a really important one. So these people left being OBGYNs. They did not leave the medical profession. They did not retire. They did not leave the state. They just said, hey, man, this hyper-political aspect of medicine, I'm not messing with this. I'm going to stay in women's health. I'm going to keep my practice, keep my patients. I'm just not delivering babies.
Well, not only political, but could I be prosecuted and go to jail for doing my job, delivering a baby versus providing gynecological surgery?
Yeah,
I think I'm going to choose the one where I don't go to jail.
You're right. That is absolutely not the appropriate word. It's not political. It's a legally risky and nebulous area to navigate. And whether or not, politics are obviously involved because that's how you make laws, right? But once the laws are passed, then you have the arm of the law, which is like, the sheriff shows up or something.
Right.
And that's the real problem, which is like, listen, I don't ever worry about getting arrested and going to jail when I just practice obstetrics or gynecology, But if I'm practicing obstetrics, I have to weigh my decisions very intensely. And even if you're following the law, you also may have to engage. Like my dad told me once that he knew a pediatric oncologist, and he was like, they don't make it. It's like they can only practice pediatric oncology for like 5 or 10 years, and then they can't, because it's so heartbreaking to be there and see these people, young people in particular, suffering. It's like, it's just something that they can't do. So, perhaps there's somebody out there who's like, listen, I'll follow the law in obstetrics, but the problem is it's going to lead to such heartbreak and turmoil and difficulty with my job. I can't do that. I'll even follow the law. I just can't stomach watching whatever happened. And so they leave that field of medicine.
Right. And this is another unique thing about Idaho's law too. So again, competing with other states, it's a triple threat. It's criminal prosecution, losing your license, so you're done practicing, and it's civil liability too. So getting sued for $25,000 minimum by a family member of somebody who says you shouldn't have done that abortion. So it's a triple threat. And then what you said about that emotional toll and not being able to deliver evidence-based care as you have throughout your entire career, and seeing patients in this very sad situation, I think that's kind of another fourth. But it's a very serious thing to consider. So no wonder some of them said, I don't want to do obstetrics anymore. It's too risky for those reasons we just talked about, but I want to stay here. Maybe I'm towards the end of my career. I want to keep seeing patients, so I'm going to do the GYN portion only.
And again, to be clear, this is not saying that the people that say that are like, oh, I just love performing abortions. Like people left Idaho and went to Utah. And Utah, again, has very strict abortion laws. They just have the exemptions. So like, look, if this woman is going to lose her uterus, or she's going to, have a stroke, or if she's going to, all of these things. And by the way, if the woman says, I'm going to kill myself, this is terrible, that's not a reason to perform an abortion, right?
That's a common exemption in a lot of state laws. Yes.
So you have this problem of like, look, a lot of states now have made elective terminations illegal, but they have carve out. So it's like, okay, but let's still take care of our women that are going to find themselves in the midst of the disease process that they did not deserve, that they did nothing to bring onto themselves, and they're trying to have children. Let's try to protect them as they navigate this very difficult time.
Right. So it's pretty striking, the numbers. It paints a very clear picture of what we at the IMA at least have been saying for a long time. Like, these laws are going to impact patient care. And how are they impacting patient care? Unfortunately, we're seeing doctors leaving, not enough are coming to replace them, and it's getting harder and harder for patients to access care. And that's a really sad part, especially the impacts shown in this study on rural parts of the state. That's going to be felt. I do want to make an important point too about this study in particular. It's only tracking OBGYN physicians. Family physicians are trained in obstetrics. Many of them choose to provide those services in rural communities and throughout the state. So they are a key part of the maternal health care workforce that isn't captured by this study. So there are those folks that are still providing some maternal health care. And then, of course, the entire healthcare team. But, when a labor and delivery unit at a hospital in a community closes down, nobody's delivering babies there anymore. Right. But I just wanted to make that distinction about the OBGYN physicians versus the family docs who also do some OB.
Can the family docs that do OB perform cesareans?
Only if they are fellowship trained. So they go through their 3-year family medicine residency where they are taught a lot of basic OB. if they do an additional year of training in what they call an OB fellowship, then they are trained to do surgical procedures.
Gotcha. So for people saying like, hey, there was a big concern that somebody related to me, and they're like, listen, if you're in this rural area and there's no OB and you need like an emergency cesarean, emergency rooms and emergency room doctors are only qualified to do that under the circumstance where it's like somebody's dead or dying, or there was some situation that I didn't quite understand. But it sounds like you're saying like, well, if you have this hyper specialized family practice person and they have to go through very specific training, obviously the fellowship program, then they can do that. So that does offer some relief in those areas. But you still need a hospital that is offering labor and delivery, which means they have a 24-hour surgery center. They have like all of these other things.
They have the nurses and all of the other members of the healthcare team that are trained to help in those situations.
I had Brad Turpin, from the CEO of the Emmett Hospital, because they had closed down their labor and delivery. And he explained to me, like, listen, man, when you're doing labor and delivery, it's not just having the OB and, whoever else. It's like when you're doing it, you need all of these other supporting departments. And if you don't have them, you're not doing it, because the second you realize you have to go into like surgery, you better be ready that second. Like you need to do it, and you need to do it really well. And just having all of that stuff gets very, very difficult in rural areas. So even if you have an OB that's willing to live in a rural area, you still need the supporting areas within the hospital system that are warranted financially to have a labor and delivery.
Absolutely. And those family medicine docs who are practicing OB in their local communities, they rely on calling and doing consultations with OBGYNs, right? And so the more specialized the care, the more training, you want the physician to have. And so a lot of those family medicine docs will rely on the OBs in consultations and that sort of thing. And so it impacts their ability to access those consultations too, when there's just not enough of them to go around.
We've gone over a bit of the study. I'm going to dive more deeply into it next week with the actual author of the study.
Yeah.
What are we missing that you really want to hit? Because again, this is a broader conversation, and I know you just want to come in and kind of give the news.
Well, and here's the thing that is very cool about this study. It was done by Idaho-based researchers. It was a peer-reviewed study. What does that mean? It means that they couldn't just make this stuff up. They had to go through several layers of showing how they made these calculations. It's also unique in that they didn't just use information from publicly available databases, which they did, but then they referenced them and then actually had granular conversations and confirmations with individual physicians to confirm this information too. And Dr. Edward McGeachern, who is the lead researcher of the study, will be able to get into that. But it's unique because it's literally a one-on-one. This data represents a person. There's no extrapolations. There's no estimates. It's like this data represents a person, which is why they're able to tell you this many went to this state, this many went to this state. And he'll also be able to talk about, again, the peer review process, which means there's a lot of people looking and basically saying, you're a tutor, Matt. So when one of your students does this brilliant math problem and comes up with the right answer, you say, well, show me your work.
Yeah, of course.
That's the right answer, but how'd you get there? And that's the process of peer review, that they literally have to show their work, and it has to be done in a methodology that's approved. So yes, he can get into the specifics of that. It's way above my knowledge level.
Awesome. Well, I really look forward to that. Thank you for coming in today. Thank you for what you're doing for the Medical Association. And again, I welcome all sides of the issue, right? Like I had Mr. David Ripley on before. Yes. I've invited him on many times, and he's always welcome to come on. This is really a really intense, problem that we all grapple with. And I don't know what the right answer is. Obviously, I'm not a medical professional. I'm not a legislator. I am a husband though, and I'm a father of 3 boys, and I hope that they'll have, have the good opportunity to grow a family at some point too. And I know that we need to figure out a way to provide better medical access for the women in Idaho.
Absolutely. And I think one thing that I was very encouraged by coming away from the 2025 legislative session was there finally seemed to be an acceptance of, okay, yes, there is a physician workforce problem. Right. Hooray! Years of work coming to fruition. Because for a while, when we were making these claims, we were told, that's not true. You're making those numbers up, et cetera. So this study gives clear data to support what we have been saying. They counted the docs. Here's where Idaho is at. If we can all agree that there is a physician workforce problem, which I feel like the legislature did this year because they have lots of ideas in how to deal with that. And then I think looking at it from, okay, all states in the country are trying to attract OBGYNs. What can Idaho do to make itself more attractive, to keep docs here? Because obviously we're still losing them. We haven't stopped digging the hole yet. And, we're filling it in with a teaspoon, but it's not enough. So I think we really have the opportunity to look and see what we can do both in the short term and the long term. And I think one of the things we can do that will have, I believe, an immediate impact, at least in stopping physicians from leaving, is looking at our abortion ban and can we make some common sense exemptions to put us on par with other states.
So your call is not like, hey, eliminate the abortion ban. It's like, hey, just add a common sense exemption for organ loss. You're going to lose your uterus. Can we just start with, okay, if we agree that this person's going to lose her uterus, that's an exemption. Like, it's essentially just, hey, can we have these exemptions so you don't have these grave risks? And some people absolutely experience them.
Right. And there's been many court cases over the past couple years that have made some small niche improvements here and there. But really what we need is a clear change in the law that everybody understands, it's very clear, and that we can confidently say to a physician who wants to practice obstetrics here, yes, your career and your freedom are not at stake if you practice evidence-based medical care.
Susie, as always, thank you for coming in. Let's do it again.
Thanks for having me.